Thank you all so very much for joining us today. I'm Lori Reeves. I'm the Executive Director for the Florida Perinatal Quality Collaborative. And I'm going to open this meeting today with just a little bit of background information, and then I'm going to hand off to the really fun presenters who are going to tell you what SOOTHE is all about and why we would love to have you join us. As you can see, this meeting is being recorded, and we're doing that because we want you to share it with your colleagues at your hospital afterward if they couldn't join us today, or if you have colleagues at a sister hospital or somewhere else that you think might be interested in watching and potentially signing on for SOOTHE, share it with them, and we'll also send it out after the meeting. So a lot of people you can see in this meeting have been a part of shaping the initiative, which I think is one of the things that makes our initiatives at FPQC so special. We don't make them in a vacuum. We make them with input and advice from the experts at our hospitals in Florida. So thank you for that. Our agenda today is pretty concise. We're going to do a quick overview of the FPQC and who we are. I'm going to then hand it off to Dr. Panagos and the rest of our initiative leads, and they're going to talk to you a bit about neuroprotection and sensory care in the NICU. They're going to go over what SOOTHE includes, what's it all about, what do we want to achieve. We're going to talk about some FAQs related to the initiative and participation in quality improvement, and then next steps. Next slide, please. Our vision for the FPQC and our values. We start with this for every meeting. All of our mothers, infants, and families in Florida should have the best possible health outcomes by receiving respectful, high quality, and evidence-based perinatal care. And we are data-driven, population-based, evidence-based, respect-centered, and value-added. There's a missing bullet because it used to say we were voluntary, but since the state passed the statute in 2022, requiring all hospitals to participate in at least 2 of our initiatives at all times, voluntarily never didn't suit anymore, so we took that off. There we go. Okay. Partners and funders. Collaborative is in our name, and we mean business. We do love to collaborate, and so what we try to do is work with any potential partners and stakeholders that may help us influence better outcomes at our hospitals in the state. I want to give shout outs to the 2 top ones on the left, because those are our major funders. We receive the majority of our support from the Florida Department of Health, which is highly invested in making sure that we help our hospitals deliver the best possible care for moms and babies. Our other funder that provides a significant amount of our funding is the Centers for Disease Control and Prevention. But we also get support from all of the other entities you see on this slide in a wide variety of ways, from components for toolkits, educational pieces, help in developing partnerships, and so on. So they are all very, very important to us, and we want to thank them all. Next slide, please. For this particular initiative, these are the 4 really special people that did the most to drive the development of the SOOTHE initiative. We have 2 physician leads. If y'all, when I say your name, wave or something, put your picture on for a minute so people can see who you are and where you are. Dr. Petula Panagos is one of our 2 physician leads on this initiative. Also, she is our Associate Director for Infant Health at the FPQC. And then we also have Dr. Joseph Cortez, who has been a coach for many of our initiatives in the past on the neonatal side, and has really been an extraordinary initiative lead and work group lead for this initiative. And then Jennifer Bilecki, who has been a phenomenal nurse lead for FPQC for several years. She has been a really great coach. Maybe she's coached one of your teams on a previous initiative. And now she is serving as the neonatal nurse lead for the FPQC, replacing Sue Bowles, who hasn't gone anywhere. Sue still helps us with a lot of things and is amazing, but decided that she deserved a little bit more free time, and so she stepped back from the lead role. Laylis Vernon is our family lead, and she brings to the FPQC an enormous amount of experience and wisdom. She is in demand across the country as a speaker in a wide variety of formats. I know I hear from other quality collaboratives that have her present, and they always rave about how incredible she is and what amazing knowledge that she has shared with their perinatal quality collaboratives. So I want to thank all four for their work and input on this. And it was a lot because this was an initiative that was developed from the ground up. So next slide, please. You all probably know all of these people already. You may not be able to put faces to the names necessarily, but this is the FPQC full-time staff. So there's myself and then Dr. Linda Detman, bottom left. She is our Associate Director for Programs and Operations. She is our longest serving staff person. She's been with us now since the very beginning of the FPQC 15 years ago. Dr. Estefania Rubio is our data lead. She's the Associate Director for Data and Informatics for the FPQC, and she's responsible for developing the measures for each initiative for helping hospitals do their data input and analysis and helping people understand what the data means, with many other components as well. We have a team of 3 quality improvement analysts, Stephanie Reyes Martinez, Sarah Steuben, and Shelby Davenport. I hope you all have put your images up while I'm saying this. And they work with you on your coaching calls. They develop the educational materials. They send out the e-blasts, the e-bulletins. They help you make sure you've checked all the boxes for getting your hospital DUA and commitment forms and so on signed. So you'll hear from them a lot. And then last but definitely not least, our data team. We have 2 additional members that work on hospital data. They will help you with technical support. If you're having trouble entering data or understanding what your data means, you might be talking with Alexa Muchler or with Leomar White. So I want to thank all of the FPQC staff. Someone said at the beginning of this call that we have the dream team. I do think we do have the dream team, and I'm really grateful to get to work with them all. Next slide, please. The FPQC does a lot, and if you're focused on infant health, you may only ever see the pathway for infant health, and that I totally understand. We just finished Homeward Bound, and we're launching this next initiative, SOOTHE. The kickoff meeting will be on October 22nd. We'll talk more about that at the end of this call. And then data collection mode will start January of 2026 and go through June of 2027. But while we do SOOTHE, we're also doing an initiative on maternal hypertension, PROMPT, which focuses on severe maternal hypertensive episodes, which are one of the many things that may cause a baby to end up in your NICU. And then we're also working on obstetric hemorrhage, which we're trying to do things at the hospital level that reduce the severity of hemorrhage incidents and reduce related morbidity and mortality from hemorrhage. And then we also do perinatal quality indicators. Every single hospital in Florida that's enrolled in PQI has access to data that shows them how they stand across a variety of measures and looking at themselves compared to the state overall. So if you haven't yet looked at your perinatal QI data, find out who from your hospital is the lead for that and get them to show you what's available there. And if you don't know who that person is, send us an email and we can tell you. We also do birth certificate trainings twice a year. This is important because birth certificate data is used, for example, in our perinatal quality indicators. And if you don't have good data going in, you're not going to get good data coming out, right? And so working on an ongoing basis to make sure that staff at hospitals that do the data input get regular training and do it correctly is helpful to us and to everyone else on improving the quality of the data. And then last but not least, levels of maternal care, which is a verification program we're doing in Florida. We have more than 50% of the births in the state now are occurring at hospitals that are verified. It's basically the same thing that NICUs have been doing for decades. So you all know you've got a level 2, level 3, level 4 NICU. That has never been implemented on a widespread basis for maternity care. And so we're working on that right now across the state of Florida. Next slide, please. Selecting the infant health initiatives. We start with forming an infant health committee. If you haven't participated in the infant health committee before and you're interested, let us know and we'll put you on the list for the next time around. But our infant health committee meets probably about 9 months before the launch of our next initiative, and they look at the data. What does data in Florida show us about what's happening with newborns? What are other perinatal quality collaboratives doing across the country? Because if there's already a great initiative that addresses a problem that we want to address here, we can often build on what other PQCs have done. What do national guidelines show? And then what do our stakeholders tell us? And that would include partners and also hospitals. So we use this information to put together a list of potential initiatives, and then we poll our NICUs. So you all would get a quick poll, or we might do it in coaching calls, or we might send it as part of the PQI survey. But we ask hospitals, what of this list, which of these would you be most interested in participating in? We then bring that information back to our infant health committee, and they make the final decision on the initiative. And in this particular case, neuroprotection rose to the top, and we put together an advisory group that started working, 6 months ago at least, and they named the initiative Supporting Optimal Outcomes Through a Healing Environment, or SOOTHE, which was the name that our family representatives thought was most appropriate for this initiative. Next slide, please. We offer a lot of resources and tools. Again, I'm not going to go in depth and read every box here. I think if you've done an FPQC initiative, you've seen this before, but we really are very service oriented. We want to make this as easy for you as we can. So we provide a wide variety of resources online, coaching calls, technical support, etc., to help you be successful as you conduct your initiative. Next slide, please. This is a new slide one of our team members developed because we often get questions from hospitals about what's the difference between a toolkit and a toolbox. So this basically shows you how an initiative is structured. If you see at the top left, every initiative usually has 2 aims. Some of them have 3. And then we develop primary drivers or key drivers that address those aims. They're designed to get us to those aims as an endpoint. Each of those key drivers has a secondary driver or change concepts, usually 3 or 4 secondary drivers for each key driver. And the important thing about these secondary drivers is they're typically where you get the data measures from. Dr. Rubio is going to talk about the data measures a little bit in a few minutes, so I won't dwell on that. And then underneath each secondary driver, and you'll see these in the toolkit, are potentially better practices or the change ideas that we have found that we think will support your work in implementing the secondary drivers and the key drivers to achieve the initiative aims. All of these are structured in these 2 pieces. The first piece there, the toolkit, is basically the guidance. What are you supposed to do and why are you supposed to do it? And then the second piece is the toolbox. It contains the toolkit and all of the other resources that have been pulled together to help you get to where you need to go. Next slide, please. All right, Dr. Panagos, I want to hand this off to you. Why SOOTHE? Are you ready?
Ready. Next slide. We know multiple environmental factors contribute to the preemie physiologic and psychologic development during the NICU hospitalization. Specifically, they occur during critical periods of neurodevelopment and can have long-term outcome effects downstream. Next slide. This review paper demonstrates the neonatal integrated developmental care model and shows to achieve optimal outcomes, special care needs to be directed in improving the NICU daily experience through minimizing stress. Next slide. And here we see the diagram representing all aspects of the healing environment that influence the growing sensory environment for the infant. And we see that the building blocks of a healing environment are the 5 senses and all the inputs that go into that. So most importantly, partnering with families, positioning and handling, safeguarding sleep, minimizing pain and stress, protecting the skin, and optimizing nutrition. And that's why we chose SOOTHE.
So with this, the global aim for the SOOTHE initiative is that 80% of participating NICUs will implement at least one evidence-based strategy from each of the 4 sensory domains, whether it's touch, sound, light, or a combination of smell or taste, in order to improve the sensory environment by June 2027. In addition, it is also the aim of the SOOTHE initiative that all participating NICUs will achieve a modest 20% increase in families who get education and training on recognizing and responding to infant stress cues. Next slide, please. So speaking of recognizing and responding to infant stress cues, that's a good segue to the 5 R's framework, which is a tool developed by the Alliance for Innovation in Maternal Health. It is a structure to structure patient safety bundles in a way that promotes high quality and equitable healthcare, not just for maternal care, but also neonates and others. And we modeled the SOOTHE initiative from this framework, which are the following. First is readiness, which means ensuring that healthcare facilities have the necessary protocols, resources, medications, and equipment in place to manage situations effectively or be prepared before a complication occurs. The second R is recognition, which means enhancing the ability of clinicians and providers, such as nurses, advanced practice providers, or nurse practitioners, or PAs, to identify warning signs or emerging complications early so that appropriate interventions can be instituted promptly, or in other words, identifying risks early and taking steps to prevent them. And the third R is response, which means mobilizing well-coordinated treatment efforts when complications arise. This includes following established protocols, acting quickly and appropriately when issues arise. 4 and 5 R's are reporting and systems learning, and respectful and supportive care, which means respectively fostering a culture of continuous improvement by systematically reviewing events, including adverse outcomes, and also centering care around the rights, dignity, and preferences of families. It emphasizes supporting informed decision-making, culturally and linguistically appropriate services, and equity in care practices. Next slide, please. So based on the 5 R framework we just discussed, SOOTHE has the following emphasis. For readiness, SOOTHE's focus is on creating a sensory supportive environment. This can be done by assessing and standardizing environmental practices to support infant sensory needs. For example, how many of us wonder or have measured the noise in our NICUs? And if we did, does the noise decibels in our units appropriate for development for our patients? And what are the best practices that we could implement to address this problem? It's just one example, and there are others. With the SOOTHE initiative, we will discuss these things, learn, and educate ourselves with these best practices. For recognition, SOOTHE's focus is on identifying noxious stimuli and stress cues. This can be done by promoting early and consistent recognition of infant stress, pain, or overstimulation. So an example of this would be protecting skin, especially those for extremely premature infants. For response, SOOTHE's focus is in delivering intentional therapeutic interactions. This can be done by strengthening caregiving practices in response to infant stress cues through gentle, purposeful touch. And lastly, but not the least, respectful care. SOOTHE's focus is on partnering with families, integrating respectful, family-centered care into every stage of the NICU stay. Next slide, please.
Thank you, Dr. Cortez. Good afternoon, everyone. So you've heard about what we are is our global aim, right? We want to support you and your care teams in fostering a neuroprotective NICU culture by training staff and providers, engaging families, optimizing developmentally appropriate sensory care, and minimizing unnecessary interventions to promote a nurturing environment for infants. And you can see our global aim at the top of the page. That's our big, big aim. We have two specific aims that are measurable, SMART goals, right, that Dr. Cortez has already shared with you. And we have a pathway that the advisory committee has been working very hard on that we are going to ask you to implement. So it's bucketed up in 3 big buckets. You can see them there. We have the sensory environment, which is going to be asking you to work on modulating sound in the NICU, promoting a developmentally appropriate light environment, enhancing olfactory and oral sensory experiences, and optimizing positioning. For the noxious stimuli bucket, you'll be working on protecting and preserving skin integrity, providing cue-based care, and minimizing pain from interventions. And then in the last bucket, you have positive touch interactions. That's pretty self-explanatory, right? We're going to be working on making sure our families know how to recognize those cues and then provide positive touch as a way to support the neuroprotection and development of the infant. Next slide. So all of that is our bucket or our theory of change. But what we're going to be looking at is collecting information of the things that you're going to be implementing and providing care for your infants. And quality improvement, data collection really tells us what's happening, right? It shows patterns, reveals gaps, and most importantly, tell us if our changes are making a difference for babies and families. So how will this look for hospitals joining the SOOTHE initiative in the future? First, at the patient level, each month, you'll collect data for up to 20 eligible infants with no more than 5 per birth weight group. So if you are working on Homeward Bound, this is going to be looking very similar for SOOTHE. But the maximum amount of patients that you would be reporting is 20. For most units, it's going to be between 10 and 15. You'll track important practices like caregiver education, how well we're helping parents recognize and respond to infant cues and providing that positive touch, and how we're protecting skin integrity throughout the NICU stay. Those are just examples of things that we're going to be collecting. Again, there is way more potentially better practices in the theory of change or in the bundle that we are providing as part of the SOOTHE initiative, but just so you have some ideas of what type of information you're going to be abstracting for each patient that you report to FPQC. And again, this is a way to track if we are having issues in implementing certain aspects of the initiative to provide additional support and also to celebrate the wonderful gains that we know that your teams will have. Then at the hospital level, each quarter, you'll share information about the staff training, the policies and guidelines that support SOOTHE, and results from your NICU environment checklist. So things like sound level spot checks and quiet time schedule adherence, those things you will report quarterly to us, just again, as a way to track how we're advancing in the initiative. And then back, you will get a report where you'll be able to compare how you're doing, how you're advancing compared to others in the initiative. In the last initiatives, what we've seen is like most units increase at the same time, and that's just wonderful to see for the state because we know that there's statewide impact. So you see, we're going to have a mix of patient-level data, hospital-level data that gives us a detailed bedside view of what's happening at the bedside, and also a big picture system view of what's changing in our facilities. So data tells us what's really important, not just what's happening. It shows, as I said, those patterns that we need to be aware of, and the whole bundle and the measurement grid and the forms, everything will be available to you once you join the initiative. Next slide. All right, and with this, I will hand it off to Dr. Linda Tedman.
Thanks, Estefania. You can go to the next slide, please. So many of you are, like me, an old timer with FPQC, and you are familiar with some of the things that are required from an initiative, but we always like to review it. So as far as the initiative lead for SOOTHE, this should be somebody that really is in a position within the hospital to make a commitment of your participation. They will serve as the team leader for the initiative and the main contact for FPQC. This should be someone who is in an influential position that can drive change, that can provide oversight and management of the initiative, and to keep your team on task and moving forward. Next slide. We, as I hope you know, offer a lot of support to you as a hospital participating in any of our initiatives, in just about any mode you would possibly want. In person, so you will be attending two in-person meetings with us, but we can also provide on-site consultation in person to your hospital if needed. Certainly virtual and phone assistants are always available, and you saw all the team members earlier. Any one of us is open to providing any support that you might need. And we will tailor the assistance to meet whatever need you might have. We can provide grand rounds to you if you would like. And as you know, you will be participating in coaching calls, which are monthly groups of hospital team meetings. We can facilitate peer-to-peer consultation, offer office hours, really anything that will help you to implement the initiative. Next slide, please. We do have in-person meetings, as I mentioned. There will be one October 22nd. 2 people from your hospital are required to attend the kickoff meeting so that they can get the information on implementation and bring it back to the entire team. If we have enough space, we can allow additional people to attend those meetings, but initially we ask that you only sign up 2 people, and then we will let everybody know if we have additional space for others to attend. Next slide, please. We don't ask you to pay to participate in the initiative. We do collect a small fee for the in-person meetings to cover some of the expenses. But as we mentioned earlier, this work is supported by the Florida Department of Health and the CDC. And as you can see from meeting some of those who are part of the advisory group, we get a lot of in-kind support from clinicians, very committed clinicians across the state, and professional organizations who want to promote and support quality improvement. Next slide, please. We often are asked about IRB review and approval. Because this is quality improvement is not considered to be research, and is often given a designation of not human subjects research. We will be submitting an IRB protocol to our University of South Florida IRB and expect that it will receive that designation, and we can provide that protocol and that designation letter to any of you that may need it, but you will need to make sure within your own hospital whether or not you need to secure IRB approval to participate in the initiative. I would hope that for most of you, you would not need to do that. Next slide, please. Initiative data, Stephania went over just very briefly, and when, as you know, or many of you know, when you sign up for the initiative and after the kickoff, we have a separate webinar that dives deeply into the data collection. But you should know, of course, that any of the data that you submit to us is very well protected. You submit the data through a REDCap survey interface, which is HIPAA compliant and behind the firewalls here at the University of South Florida, as protected as anything can be. Each hospital will sign a data use agreement that describes how those data are protected, used, and kept confidential. And just to clarify, we as FPQC are not a vendor and not providing services to your hospital. So there is no need for a business associate agreement to participate. So that is something you would convey to your own hospital, often legal team, I believe. But if there are questions, we are always available to work with them through getting the data use agreement signed. Next slide. Can you apply for more than one quality improvement initiative? Of course. And as you know, the state statute requires all maternity hospitals to participate in 2 FPQC maternal and/or infant health QI initiatives at all times. Currently, SOOTHE is the only one that we are recruiting for. I believe most of the hospitals are also participating in one of the infant initiatives. All the maternity hospitals participate in PQI, which counts as a quality improvement initiative as well. But if you have questions or want to know more about current initiatives, you can go to our website, and of course you can email us as well. Next slide, please. So how do you get involved in SOOTHE? Because I know you're all chomping at the bit. You would complete the application that's available through Qualtrics. And I don't know if we're going to drop that in the chat here or not, but we have sent it out, and we'll continue to send it out. Each member of your team, so when you do complete that survey, you need to indicate who will be your team lead, who will be the physician lead, the nurse lead, data lead. And those individuals, they can sometimes share roles, like the initiative lead may also be the nurse lead. But every one of those individuals will need to respond to a commitment email that comes from FPQC, so that we have assurance from them that they are committed to participating in the initiative. Your hospital will sign a commitment letter, you'll sign the DUA, and then have at least 2 people attending the kickoff meeting on October 22nd. And that will be held at where we've held the last few meetings, at the Advent Health Nicholson Center in Celebration, Florida. Next slide, please. So here's our timeline for the SOOTHE initiative. We are into recruitment right now. The initiative kickoff, as we said, is October 22nd. The actual start of the initiative for your hospital will be January 1st, 2026. Prior to that, there'll be some baseline data collection and just engagement with getting your team settled in your hospital. And then once you kick off, we'll be on a regular monthly schedule of coaching calls, data collection, and of course, any technical assistance, whether on-site or otherwise, will be available over the course of the initiative from January 2026 through June 2027. We will hold a mid-initiative meeting sometime next fall. I haven't determined exactly, but likely to be in September. And then the initiative will be completed in June of 2027. Next slide, please. Recruitment information and other announcements, join our mailing list. So at the website, fpqc.org, under the Get Involved link in the left side navigation bar, you'll be able to do that. We also have a Facebook presence. You can join the FPQC Infant Health Discussion Forum at facebook.com/the-FPQC. So there's that link to apply, and there's a QR code as well if you want to snap a photo of that and go ahead and get started. The deadline to submit an application is a month before the kickoff, so September 22nd is the deadline. As always, we try to answer as many questions, and you have an opportunity. You can either put in the chat now or raise your hand and come off mute and ask questions. If you would prefer to ask via email, the website, or sorry, the the email address is there, fpqc@usf.edu. At any time, any questions.
Okay, thank you, Lori. And thank you, Linda, for going over a lot of the frequently asked questions in our timeline. So this is just a reminder and a save the date for our SOOTHE initiative kickoff. Again, just to reiterate, the expectation is to have 2 members of your team attend the in-person kickoff meeting. Keeping in mind, if space allows, more can come. Sometimes that occurs. It's on Wednesday, October 22nd at Advent Health Nicholas Center, which those of you that have participated in other initiatives are very familiar with that center, and that's in Celebration, Florida. Very close to all of our parks in Orlando. If your hospital plans to participate in SOOTHE initiative, please have your team leaders save the date, prepare everything ahead of time, and I'm sure that registration will be going out shortly, and encourage all of you to participate. Thank you so much. I'm going to turn it over to Laylas, who will do an introduction of a wonderful keynote speaker that you will have to look forward to at our kickoff event on October 22nd. Thank you.
Yes, like we needed more incentivizing these teams, right? Our meeting aims at not only informing you as to the technicalities of our initiative, but also inspire you. And so we are bringing this wonderful, wonderful physician, Terry Einder. Many of you might have heard from her from many national. She is actually an international speaker, a dual boarded physician, a neonatologist and a neurologist. She's the chair of Center for Neonatal Research at Radis in California. And her research focuses not only in evaluating how neonatal stress and pain and sensory environment affect the brain development and neurodevelopmental outcomes, but she is also a big advocate for nurturing and enriching exposures by partnering with families. I can promise you, I've heard Terry a handful of times. I promise you this is going to be an inspirational presentation, very eye-opening, very enriching. And so we hope that this will be one of the highlights of our time together in October. And we also hope that you can take all this information that you're going to get from our wonderful keynote speaker back to your teams and spread the goods. I can tell you, as a family, I was personally touched by how she approaches partnering with families in neuroprotective culture of care. So that's wonderful news. Please bring more teammates if you can, and if our space allows. It will really be an improvement, an improvement cycle in itself to come to hear her talk.
Okay, we're at the questions and thank you section. And I just wanted to remind everyone that Sarah put a note in the chat. There was a question about when you got the registration for the meeting, and it's after your hospital completes the required documents for the application. Then we send out the registration link at that point. And then there's another question about the data collection sheet. And Stefania, I know you typed the answer in here, but will you speak it out loud? The question is, when will we get the patient data collection sheet to better understand the data that will need to be collected? Do you want to tell the group, Stefania?
Absolutely. That was a wonderful question. So we are finalizing measures. We have all the potentially better practices that we are focusing on, but the details are still being shaped up. And so as soon as that is done, the measurement grid will be available along with the data collection tools. So that my expectation is that will be in the next 2 to 3 weeks. And we will be happy to share all that information with the group. The data collection forms are very similar to what you're used to if you have participated in one of our initiatives. If you are new to FPQC, the infant side of things, we could direct you to what the data collection form looks for Homeward Bound, just so you get a sense of what it looks like. But the final forms for SOOTHE should be available between 2 to 3 weeks from now.
Thank you.
Mhm.
Does anyone else have any questions for any members of the team or for any of our advisors? We have a question from Catherine. She has her hand raised.
Yeah, I was wondering, is this the data that we're going to be collecting based on discharged patients or actively in-house patients?
Good question.
Thank you, Catherine. So we always collect on patients that are discharged from your unit, so you have all the information required. Most of the time, we're going to ask questions from the beginning of the admission towards, how well discharge went. And so we always wait until the patient is discharged, so you can go back and abstract what happened for the care of that specific infant. Now, everything that we're doing in the bundle is going to be applied throughout the NICU stay, right? But for the data specifically, we will ask you to look at the patients that were discharged and then look back.
Excellent question. Any other questions?
Will the birth weights be the same as we were in Homeward Bound?
Yes.
Okay, thanks.
Thank you.
We did
All
have
right,
a
let's see.
question in the chat about when the toolbox will be posted. I'm just going to share the answer so everyone can hear, but we usually post the toolbox in October, either right before the kickoff or right after the kickoff. And the toolbox is updated throughout the course of the initiative.
There is one other question in the chat from Deborah Bryant. Deborah, when you say grants, what kind of grant are you thinking?
Like I know with Homeward Bound, there was the We Care for NICU grant, so we could utilize funds from that grant to assist us with providing some of the items that we would need for the patients to have a successful transition to discharge. I didn't know if there was going to be something, a grant in place for this particular project.
So it's an excellent question, and I'm super excited about it because it means you guys took advantage of the grant, which is wonderful. we are really glad to hear that. The answer is that FPQC will not be doing any additional grants to provide those resources. We are simply not structured in a way that it made it easy for us to get the money to hospitals or for hospitals to process the money from us. But I know that there are other things potentially in the works, not from FPQC, but from partners. And we should know by the end of the year if there might be any additional resources to support some family needs. But I cannot make any promises, or I can't even say that I'm really optimistic. We just don't know yet. It's a grant cycle that someone else is applying for, and they won't have an answer until December. So stay tuned. We will let you know if anything happens. Any other questions?
And Lori, I
Is
just
there
like to say for hospitals,
Yeah.
don't forget you all have foundations. Many of you have foundations, and you can reach out to foundations. And if you're using, and I know we're not going to support, I'm not trying to support vendors, but if you have like Angel Eye or Dandelion or some of these other Medela, just other vendors, don't forget they offer grants as well. And as long as you keep your grants under $10,000, you're well under what you have to report to the federal government, and you can use those grants, and they can also help you. So don't feel like you can't look for grants, because there are grants out there that you can look for yourself for your own hospitals, and you would be surprised at how you can get them. And
That's a good point, Sue, that not only that, there are many businesses that do community-based awards. Publix used to do them. I don't know if they still do. Walmart used to do them. You can just call a few of the businesses in your community, particularly if they sell newborn products. They might be interested in helping to sponsor some parent support at your hospital, because they want to get the word out to the families that they're a great place to come and buy diapers, for example. So it's worth exploring some of those options. I used to work for a nonprofit and we raised money all the time. So I know every community has small grants available like that. If you spend an hour or two a week for a couple weeks, you can probably find someone that would make some resources available. Also ask your Healthy Start. Some of the Healthy Start coalitions have access to pack and plays or car seats and may have other resources. There are other community organizations that sometimes provide car seats. So we don't have a comprehensive list, but your Healthy Start coalition might be able to point you in the right direction for more parent resources. All right, I don't see any more questions in the chat. Are there any last requests? I don't see any hands raised. Jennifer's got her thumb up. All right, I'm super excited about this initiative. I think it's going to be a lot of fun and I think it's going to make a big difference. And I want to recognize both our advisors and our initiative leads for all the work they have put into this. Some of the work groups have met almost every week for several months now, reviewing literature, doing some exploration into what resources are available, carefully picking apart those resources to see if they are indeed the best fit to offer families here. Leilos has run some things by families to see if they get the family a sign off, so our team of advisors has done an enormous amount of work to bring this to fruition. And I really, want to thank them and congratulate them for a great job, and hope you all seriously consider signing up for SOOTHE. Thank you, everyone, so very much for your time. We appreciate it. And you don't have to do your own literature search. If you love to do it like Sue does, we welcome you to do that. But we also have lots of resources that the team has already reviewed that are going to be in our toolbox. So it's not a requirement for participation if you don't have time. Although I was impressed, Sue, when I saw today that you found such a nice document from Ireland. Thank you, everyone.